Hi, I'm a level 1 nursing student. Can I ask you about your patient that you're taking care of today?
Yeah, of course.
Alright, what's the SPAR report on your patient?
Okay, so do you have Mr. Jarvis Ronald?
Yes, I do.
Okay, so he is in room 622. He is a type 1 diabetic. He is here because he has a sore on his right foot. It's a stage 2 diabetic ulcer. And he also has something that you need to be aware of when we go in. He has an IV site on his right arm, right here. And he is a full code. He's 67 years old. He's a male. He has no known allergies. He is a fall risk, so we need to be aware of that as well and keep an eye on him. He is, he drove himself here from his physician, and he is, he has a pain, or when he came in, he had a pain of a level 6, and we gave him some pain medication, so now he is a level 1 in pain. And he wears glasses. He is alert and oriented ×3. His pupils are equal, round, and dilated. He is no cranial nerve problems. He has full range of motion. He moves independently with a walker occasionally he needs to use, or assistance. So he needs to be aware that he needs to call in case he needs any help. His breath sounds are clear to auscultation. His breath patterns are even and effortless. His pulse ox is a 95%, so his oxygenation is good. His heart sounds are regular. His apical pulse is regular. His pulse is a 2+, as expected. His capillary refill is less than 3 seconds. His last blood pressure was 145/72. His heart rate was 80. His bowel sounds are active in all 4 quadrants. His abdomen is flat, it's not distended. He is on a diabetic diet, so that means he needs to have a calorie intake of only 180 and only 2 grams of sodium. His last void was 322 milliliters of output. It was clear. It was yellow, straw-like. So what we need to be aware of is his IV site. We need to check on that. We need to make sure that he uses the call bell in case he needs to get up. We need to also pad his heels and turn him every 2 hours, make sure that he doesn't develop any more sores since he is at high risk. And we need to make sure that we manage his diet properly and teach him about that. We're about to give him some insulin if you want to come.
Yeah, I just have a couple more questions. Why is this client, what kind of medication is it?
He is currently taking a medication called Glargine. It is also known as Lantus.
Why is the client receiving this medication?
This client is a type 1 diabetic, so we need to keep his blood glucose under control. His last blood glucose reading was 290. If it gets above a 301, then we need to notify the doctor. So we need to keep that under control.
What action does the medication have on the body?
So the insulin is going to lower the glucose concentration in the body by facilitating the uptake of glucose in the muscle and the fat tissue, and by inhibiting glucose production in the liver.
When should you question administering this medication?
So if the client is feeling hypoglycemic, he is dizzy, weak, confused, and having any other signs for hypoglycemia. If we take his reading and it's low, then we would want to hold off on that because it could lower it even more, and that could be detrimental.
Does this medication have a therapeutic serum level? No. And what vital signs should I monitor?
So we're going to monitor his blood glucose before we give it to him, which we already took it. We're going to keep monitoring that, and he is going to have to take a hemoglobin A1C test in the future. He's going to have to continue taking those.
And which physiological parameters should be monitored when the medication is being administered?
So we're going to check his abdomen or his arm, wherever he has been getting the insulin, and make sure that there's no redness, heat swelling, inflammation, that it's not infected, the site, that it's not hardened anywhere from injecting it in the same site too many times. Any reaction around that skin in that area that we administer it to, or any anaphylactic reactions we want to look out for, so if he feels short of breath or things like that.
And what interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
Okay, we're going to want to make sure that he has eaten not too long ago, or that he is going to eat something. We want to make sure that his blood glucose isn't low, which it isn't, that he's not experiencing hypoglycemia. We want to make sure that we do all our medication checks, that we have the right patient, that the medication interacts with the other medications well that he's taking, which they do. We've already checked that. And that's the main things for in the hospital.
And what interventions must be taught for taking the medication safely at home?
For taking it safely at home, we want to make sure that the patient knows how he is administering it, how to administer it, how to store it. He needs to know, like, patient safety stuff at home, like how to dispose of his needles, to make sure that he's disposing of it correctly, because he can't just throw it in the garbage.
And what kind of side effects and potential adverse reactions to this drug are there?
So as we talked about earlier, any anaphylactic reactions, closing of the throat, if he is feeling hypoglycemic or hyperglycemic, then we want to watch out for that. That's pretty much it, the same ones that we've already discussed.
And how will you know this medication is effective?
Okay, so we'll know that it's effective when we take his blood glucose, that it's at a maintained level, that it's below what it needs to be, so below 300 is preferable.
All right, I don't have any more questions right now, but can I watch you give insulin to your patient?
Yeah, come on. So we're going to I'm going to check his MAR right now before we give it to him. Okay, so the medication is Glargine and we are to administer 18 units, and on Tuesday at 1600, so we have the right patient, the right medication, the right time, and I'm going to draw the right dose. I just want to clean this top area before sticking any needles in it.
My stomach's fine. How many insulin, or how many units of insulin are you giving me?
You're getting 16
today because your blood sugar is 290.
And you want to have another nurse check it after you.
Okay, do you have any questions? Now, if you have any, if you feel dizzy or lightheaded or you have any allergy reactions, then just call me. Here's your call height.
So, nurse, can you tell me how many units we have?
Information for you on the
18?
diet
Yeah.
and
Okay.
information on your diet.
Now that we have the right dose, we're going to go into the patient and introduce ourselves.
Well, here's a diabetic diet, and that'll help with that.
Knock, knock.
Come in.
Hi, Mr. Jarvis. I'm just going to close this and give you some privacy. How are you doing today?
I'm doing alright. I'm a little hungry, but
Oh, you are? Okay. I actually brought you a couple of snacks just in case. Before we give you the insulin in case you are feeling hypoglycemic. So I'll just leave that there next to your bedside.
thank you.
Okay. Can you actually tell me your name and date of birth for me, please?
It's Ronald Jarvis, January 12th, 1948.
Oh, okay. I'm glad you're the right person. Do you have any allergies?
Not that I know of.
Okay, yeah, it says that in your chart. Okay, so I'm just going to wash my hands here. We're going to be giving you some Lantus Glargine today. Do you know about that medication that you've been taking?
I would like more information about it.
Okay, this is your bedtime dose, actually. It's going to keep you at a therapeutic level. It's long-acting insulin, so that you can not be, have such a high level of glucose in your bloodstream while you're sleeping, and that you won't wake up, you know,
Yeah.
hypoglycemic. Okay.
Yes, it did, because
So is there a special area that you would like me to use?
I would like in my right part of my stomach, my abdomen.
Did this information affect how you administered it?
Okay.
it definitely did because of the glucose rating. The insulin was on a sliding scale, so we had to compare.
Okay, I'm gonna, while we let that dry on your tummy, I'm just going to
Thank you.
scan you.
I didn't have answers to the last question, obviously.
It's fine. It was like the same thing.
Was that right, though?
Yeah.
Did I miss anything?
I don't think so. I was trying to pay attention because you like were giving me heads. I was like, oh man, I think she did everything.
I think I did. I don't know.
I think you did. It can only get better from here.
Right,
So.
exactly. Alright, so now we have to
All right.
do,
The patient teaching. It shows, tells you like what to put on.
okay.
All right, we're in the green.
Green means go.
Green means go. Okay. That looks almost dry. I don't want it to burn. There's an area right in the middle that's dry. Okay, so I'm just gonna pinch and stick it in. you okay?
I'm feeling alright.
Is there anything I can get you?
I think you brought me what I needed. It was a little snack.
Okay, great. Is there anything else you'd like to know?
What should I do when I get home? How should I administer it? My insulin.
Okay, so you're going to administer it the same way as I did. You're going to want to check to make sure you have the right dose, which is 18 units on here. It should be the same when you go home.
Should I inject it to the same place
You're gonna
every
wanna,
single time?
Alternate the areas, so if you just did it in the stomach, you might want to do it in your arm. You're going to want to do it at a 90-degree angle. You're going to want to store your medication properly. You're going to want to make sure you check the expiration date. That is huge because I know some people who their medication has expired and they haven't even realized it, okay?
Okay, wow, thanks.
Also, make sure if you don't have one of these sharps containers for your needles that you get one of those. It's very important that you dispose of your needles in the proper way.
Okay.
Is there anything else you'd like to know? I see that you're not wearing a diabetic arm bracelet. I think you should consider wearing one of those just in case you ever have a hyper or hypoglycemic event.
Alright.
Okay?
Out in public? Is that what it's
Yeah.
for?
Because, for out in public, if that happens, someone might not realize and they can help you that way.
Okay.
Okay?
Thanks, nurse.
You're welcome. Do you have any other questions, student?
I think I do. I have a couple actually. Can I ask them?
Yeah.
Were there any pertinent pieces of info you reviewed before administering the client's medication?
Yes, you want to make sure that you have the, you want to make sure that you have the right, glucose. If you don't have the glucose reading, then you shouldn't be giving this medication. And if it's too low, you shouldn't be giving it. And we took that already, so.
Did this information affect your decision to administer the medication?
No, it didn't. Actually, if it would have been a different reading, then yes, it would have.
And did this information affect how you administer the medication?
Yes, I wouldn't have administered that many units if the patient had lower glucose reading, blood glucose reading.
I think that's all the questions I have about this patient. Thank you for letting me work with you.
You're welcome. I enjoyed meeting you.
Thanks.